With me now, infectious disease specialist, Dr. Bob Arnot. Good evening, doctor. You are known as Dr. Danger. You've provided humanitarian relief in some of the poorest areas of the world. First-hand experience with Ebola. Now, what everyone wants to know, is there a risk to Americans in bringing these infected medical personnel to the United States?
Well, great question. I mean, this is a great team. The CDC, Emory University, great ambulance service. So the risk is very low, but it's not zero. Remember, there was a South African man who was evacuated to South Africa, and he infected a nurse, and the nurse died. So mistakes can be made. The interesting thing, Your Honor, though, is did they need to bring him here? He walked out of that ambulance. This was not a gravely ill individual. The fact is, he could have been treated in Africa. When I had cholera at the end of the Rwandan genocide, I insisted on being treated in Africa until I was well enough to come back so I wouldn't infect friends and relatives.
All right.
I don't think it was necessary for him to come back.
All right. So you bring up some great issues. Number one, let me go back to the first part of what you said, and that is, you know, we have a doctor and a medical person, I'm not sure, maybe it's a nurse. The two of them are treating Ebola. Nobody knows more about treating that virus than these two people. How did they catch it?
So how did they get it?
Yeah.
Exactly right, Your Honor. Exactly right. How did they get it? I mean, I was in an Ebola epidemic ward in northern Uganda, Gulu Hospital, and I walked around with these doctors, and I had the mask and all the protective gear around. The two doctors that I walked around with, one of them touched a patient here on the hand. They bleed under the skin, you know, during their last days, and the other one had a single droplet go right here with his mask off. Both of them were dead within 5 days.
You know,
so despite what you think you know about this, it's a pretty deadly, pretty awful disease.
And I've heard someone say that, you know, what takes AIDS 15 years can take 3 or 4 days if you have Ebola.
That's my quote.
Yes,
exactly.
that's why I said I heard someone say that.
Well, I love what you quote. So it attacks the same components of the immune system. That is, AIDS and Ebola attack the same components of the immune system, but AIDS is going to take 5, 10, 15 years to develop, whereas this disease is taking just days.
All right, let me ask you this. You're on an airplane, all right? The symptoms of Ebola, doctor, as I understand it, are similar to flu-like symptoms. You know, you may be, you know, nauseous, fever, headache, vomiting, where it's not full-blown yet. And so you can actually, you know, spread it around that airplane. I know it's not airborne, allegedly, but if you sneeze, someone sneezes on you, or you touch something that they've touched, I mean, talk to me. That's dangerous stuff.
Sure. So here's the interesting thing. Here are two scenarios. One is you have a patient who gets on the airplane, and during the trip, they have the sweat. They feel like they have the flu. They got aches and whatnot, and they're kind of indistinguishable from having the flu. Now, as the disease goes on and they develop nausea, vomiting, diarrhea, and then eventually they start to bleed out of their eyes and skin, of course, it becomes a much more serious disease. Once they start to have symptoms, they are able to infect you. Now, they infect through body fluids. So, for instance, blood is an example, feces, urine. Those are the kinds of fluids that infect you. So, sure, someone could be on an airplane, could be ill, they're starting to look for them, get to an airport, and, of course, infect those around them if they were to touch their skin in the very, very late serious parts of the disease. But the real nightmare scenario, Your Honor, is this, and it is that you have somebody who's infected, say in Liberia. It could be 2 or 3 weeks before they start to develop symptoms.
Right.
In the meantime, they have flown to Phoenix or Aspen or Honolulu or someplace where they don't expect this. They think they've just got the flu. All the doctors and nurses are in there touching their body fluids. They're passed around. They're maybe not taking the precautions they should because they don't expect Ebola.
They don't expect it.
No, that's exact.
So why are they being treated? Why are they being treated here? I mean, they are Americans, and you know, the question is, could they have been treated just as easily in Africa? Isn't it just IVs?
Absolutely. In other words, there was no reason, medical reason, to bring them here, especially when you see how well Dr. Brantley was. I mean, you know, it's supportive care. You give them intravenous fluids. There are excellent hospitals there. They're much more used to treating this. The reason is this. So the head of Samaritan's Purse, who's a wonderful human being, one of the best human beings I've ever met, Billy Graham's son, Franklin Graham, who I've worked with in Africa for 2 decades, he takes the best care of his people of any relief organization in the world. He had a couple of his members taken hostage, I think in in Sudan. He went to the ends of the earth to free them. So he's going to make certain they have absolutely the best care on the planet. But you're right. They didn't need to come here to save their lives, bottom line.
And so, Dr. Bob, very quickly, I mean, the fact that it was Samaritan's Purse and they had Franklin Graham, who was a powerful individual, the United States could not have said no to the entry of the patients. Could the United States have said no?
They could have, but they facilitated. The State Department facilitated it to make it easier rather than harder.
All right, we got to take a break. Dr. Bob Arnot, thanks so much. And coming up, the latest on the crisis in the Middle East next.